Welcome to Fahrenheit 140.
Why 140? It's the temperature that water burns after 6 seconds. I'm Robert Mace.
And I'm Carrie Thompson, and we're the Fahrenheit 140 co-hosts covering the news you need to know about climate change in Texas. Well, howdy, everyone. Welcome officially to the summertime.
Woo, it's hot out
You
there.
feeling it?
Oh, yeah.
We're just talking today a few days after the summer solstice. Did you do anything? Celebrate the solstice?
I did not do anything special and celebrate the solstice. Too hot to be
Too hot to dance.
nude
around the
sunbathing
moon.
or anything like that. It was just too hot.
Well, that's perfect because this episode is all about the heat
It is.
and health. After we finish sharing some of the news that we found for this month of June 2024, we're going to talk to Dr. Rose Jones, who's a medical anthropologist, and get a little more info about health and heat and climate change.
Yeah, she's an expert on heat and health. She has a company she just launched, Rapid Anthropology Consulting.
Oh,
She comes from academia, but she's left academia to really kind of dedicate her life at this point in her career to helping communities and people deal with heat.
very cool.
Yeah.
Can't wait to
Perfect
talk
timing.
to her.
Yeah, perfect timing.
We need that kind of help, right? What are you going to do to stay cool, Robert?
I try not to stay too far away from air conditioning, I guess, but I also will sweat profusely.
Oh, nice. That's a
Yes,
great image for
yes.
everyone. Thank you. Moving along.
What about you? What do you do to stay cool?
Beverages are key, you know?
Yeah,
No, just get up early.
yeah.
Get up early. Take my
I do.
walks at night.
Yeah.
You know? The other thing I did was go to Portland, which was really nice.
Oh,
It's so
yeah.
nice there. The weather.
What
Why
was
does
the
anyone
temperature?
live here?
Yeah.
So I came across this article called, actually it's a publication, it's a research paper put out by an organization called Frameworks Institute. So you can find them at frameworksinstitute.org.
hmm
The title is Climate Change in Early Childhood, a science-based resource for storytellers.
Cool.
And what I loved about this paper is, I guess it ties into the whole focus of this organization, which is to talk about how to frame issues so that they're
hmm
manageable or things that you can actually do something about.
Mhm.
So
Neat.
they kind of seem to be targeting this one to Hollywood producers, which is it's kind of interesting.
That is interesting.
But they're pointing out that children, especially from 0 to 5, are especially vulnerable to the impacts of climate change, largely around temperature, actually. They talk about dehydration, water contamination, or reduced access to food, impacts to fetal development, overheating, disturbed sleep, creates some loss in learning, and then, of course, exposure to mosquitoes and pestilence, like we all are going to be more exposed to, and of course, stress and trauma. But they're saying, that the younger children, especially from 0 to 5, are extremely vulnerable to these stressors. And then they go on to talk about how knowing that and messaging about that is really key to get people to frame this as a problem that has a solution. So it's kind of funny because they say, don't start with the crisis, although their paper starts with the crisis. They go on to sort of say, so these are some of the pointers in how to message around this. Frame it as solution oriented. Steer clear of the idea that climate change is just happening, because there's a lot of disempowerment that's going on because of that
Mhm.
messaging. People feel really helpless.
hmm
But there are actors that have power that can influence actions that make a difference. And so reminding people about that. This one was interesting. They said, be careful about labeling communities as, quote, vulnerable, right? We talk a lot about
Mhm.
that as, you hear about
Coastal communities.
yeah, or disadvantaged lower income
Mhm.
communities do tend to bear the brunt
Okay.
of climate change. But that type of messaging and not being thoughtful about that messaging can be really disempowering also.
Mhm.
It's sort of like that battle's lost, and it's not. And they talk about really just building community support, and that people really haven't thought about climate change in this frame. I guess hidden behind that is probably this idea that we all want to help children. We
Mhm.
all want to keep children safe. And so
Mhm.
it seems like their effort here is to try to get this into pop culture in a way that people can understand it and feel empowered to do something to protect the most vulnerable among us. So
Okay.
Anyway, it's kind of
Cool.
neat.
It is neat.
In our work here at the Meadows Center, working with stakeholders, framing is a big part of what we're doing, is trying to get people to look at problems in a new way. So I thought this was a good resource.
That is good. Yeah, I should read that.
Yeah.
I tend to be Dr. Doom on a lot of things, although I don't intend to. Well, my first article was about this heat wave. And it's interesting for several reasons. The title of the article is "Climate Change Made Heat Wave Even Warmer and 35 Times More Likely."
Whoa.
And it comes from Ponca City. So it must
I've
be.
I've been to Ponca City.
Oh, have you?
Yes.
Yeah. So one thing that's interesting is they're talking about really kind of the current heat wave and heat dome and how quickly a climate attribution study has come out. That's one thing I found fascinating, because in the past, those have taken quite a while. And so it's suggesting that the climate attribution studies can almost run in real time now, because it's referring to early May events. So they said that there was basically that these higher temperatures, 35 times more likely and 2.5 degrees Fahrenheit hotter because of global warming and climate change. They have some quotes in here. A fellow from Veracruz in Mexico, where the Sonoran Desert hit 125 degrees. Which is the all-time hottest day in Mexican history, and it was in May, which is phenomenal. I also talk about this heat wave has really elevated evening temperatures, and we're all focused for the most part on how hot it gets during the day, but these evening temperatures are really important, both on heat and health, because you can't escape the heat if the temperatures stay real high. There's also agricultural impacts from those high temperatures. But they said that with this recent heat wave, made nighttime temperatures 2.9 degrees Fahrenheit warmer, and that unusual evening heat was 200 times more likely due to climate change than if there was no climate change. So that's a bit disturbing, and also a pretty clear connection. I mean, it would still be hot in Texas without human-forced climate change. It's just getting a lot hotter. And then there was also a shout out in here to San Angelo, Texas, which hit a record 111 degrees on June 4th.
Wow.
And that between June 2nd and June 6th, the nighttime temperatures never dipped below 80 degrees. And there were 2 days when the thermometer never dropped below 85 degrees.
Just kind of talking about those nighttime temperatures, I think most of us growing up remember that most mornings there's dew on the grass. There's moisture. There's that feeling of moisture in the morning. And that's one thing that the heat is going to change for us, is that we're not getting that overnight replenishment of moisture. So the drier those soils are, as the temps stay high, you're not going to get that buffer that we've always enjoyed with that nighttime recovery of the low temps, right? So that's kind of one of the problems that multiplies as you go forward. So drier soil, drier vegetation means drier everything, right?
Less runoff. Less recharge to aquifers.
Right. And of course, that has impacts on ecology and all the critters as well. A lot of whom get temperature cues for reproduction and other seasonal traits. So
what's your second article? See, I lived up to my name of Dr. Doom.
Yeah, well, I'm bringing it too. Actually, this article, it's funny. It's from smilehub.org. Is that a news thing?
Sounds happy.
It sounds happy. Yeah. It's not. But I clicked on it because actually I found this article linked through a news article from Houston. They analyzed a bunch of data sets, and they came up with a list of the top, like kind of ranking the states as far as how well they're doing in their preparedness for disaster.
Mm-hmm.
And you want to guess where Texas is?
At the top?
Sure. No, 42.
Okay. Oh,
42 out of 50.
Oh, okay.
One of the least prepared states.
Least prepared. Okay.
Yeah.
I flipped it there. Sorry.
Even though we have, I don't know if we're number one for disasters, but we're at the top for disasters, and we're one of the least prepared. And it says the bad news doesn't stop there. The Lone Star State was 49th for the number of climate dangers. So really high risk, already over $1 billion in damage. And then we also have the lowest number of mental health counselors per capita, 49th out of 50. So we don't have a lot of mental health support. And 47th for community resilience. That's the bad news. The good news was through the Houston TV channel, which we'll post the links. They actually did have some really great links. As you'd imagine, they're more focused on tropical storms and hurricanes.
Mm-hmm.
They do this survival guide, which has some really great tips, ways to be storm ready. But my favorite one was they had a little article where they went to HEB and the Dollar Tree to build a disaster kit and gave you some really good pointers and also tried to be cost effective.
Mm-hmm.
But this is kind of becoming a way of life. You need to have water on hand. You need to have toilet paper. You need to have hand sanitizer, medicine. They just kind of run through all those reminders. But you want to guess what the number one hot selling item is during a hurricane? Body wipes.
Body wipes
was the hot cake item at the Dollar Tree and HEB. They said they cannot keep those in stock when there's a storm in town. So,
right. So you still shouldn't flush them.
Don't flush them.
Yeah, don't flush
right.
them.
Well, you probably won't have any water, so.
Yeah. That's true. That's true. My second article, my friend Sharon messaged this to me, comes from Popular Science. And the title of the article is "Cow Poop Might Make Cleaner Hydrogen Gas a Reality."
It's always about cow poop.
Well, poop can be useful, as this article shows. So it's basically how to generate hydrogen fuel, and do it in a green way. What these folks from University of Illinois Chicago did was they're using biochar derived from kind of byproducts from agricultural industry. And they're using green power to then do chemical things with this biochar to develop hydrogen fuel. And they looked at a number of different biochars, derived from sugarcane husk, paper waste, hemp, and yes, cow manure, and used electrolysis then to generate hydrogen. So what they found was that the biochar used in general, regardless of where you got it from, used a lot less energy to create hydrogen. But of the five, it was the cow poop that was the clear winner, reducing electricity needs by 600%.
Wow.
So like a serious improvement and reduction of the energy required to generate hydrogen. So, cow chips aren't just for, frisbeeing at your friends and family. You can actually use them to generate fuel.
Amazing.
Yeah, that's pretty amazing.
I just saw somewhere in California. They're using beef tallow for jet fuel. Have you seen that? I think they call it SAF. It's like an alternate jet fuel, and it's way low carbon, but it's pretty affordable in principle, except you have to cart the tallow across the country. So they get train loads full of it. So it's interesting how much cows are at the center of this whole climate question, And you and I were talking about grass-fed beef the other day.
Right.
And how there's some mixed messaging on that. But we were also in our discussion, just to let everybody in on that. I have a long history of working with ranchers and trying to keep ranches intact, because the idea is, there's nothing more helpful to the environment than intact ecosystems, right? And natural landscapes. And a lot of the largest swaths of land that are intact are being held because they're functioning ranches. So, all right, so we're going to get to talk to Dr. Jones.
Yeah, so probably should have kept my heat article for second, since it would have been a better segue rather than cow poop. But we are pleased to have Dr. Rose Jones join us as our interview today. And she has a doctorate in medical anthropology from Southern Methodist University and has extensive experience in academic and applied research. She's held faculty and research positions at UT Southwestern, Parkland Hospital, and the Children's Hospital. Her research encompasses planetary health, extreme heat, climate epidemiology, and qualitative methods. And her work has taken her throughout rural Texas, along the border with Mexico, Jamaica, Barbados, and different parts of Native America. She's published in peer-reviewed journals and edited books on diverse topics ranging from climate change to medical education and pediatric trauma. She's currently writing a chapter on public health for a forthcoming book on climate change in Texas. She recently launched Rapid Anthropology Consulting to build awareness for policy change at the intersection of health, heat, and human rights. We've included a link to Rapid Anthropology in the show notes, along with some other resources based on her recommendations. Well, welcome back, everybody. We're pleased to have with us Dr. Rose Jones. Rose, good to see you.
I appreciate being here. I'm looking forward to our conversation.
Yeah, likewise. Very fascinating stuff. I don't know what most people think a medical anthropologist does. My very limited understanding of anthropology is I thought it involved hairy, grunty people in Northern Ireland. But this sounds like you're observing us today. So what is medical anthropology?
Bingo. You're right. Most people think that I do forensic work, but I actually work with living people as opposed to dead people. Medical anthropology is a very broad field, like psychiatry is, for example. So there are a lot of different areas of specialization and different types of focuses and topics. My own area of expertise has really been in public health. My first position was at UT Southwestern on faculty as a PA in the PA department. And then I spent most of my career doing as a research scientist at Children's and at Parkland, and focusing specifically on HIV/AIDS and then pediatric trauma, health literacy. So really working between the space of academic medicine, public health, and community outreach. So yeah, that's kind of what it is. I think that there aren't a whole bunch of us, but I think that increasingly we're working outside of academia and into the community and at the applied level. So
that's wonderful that you're working in, highly academic field, but also striving to make it apply to the real world around us.
Exactly.
So how does medical anthropology relate to climate change?
So I think like many disciplines, including anthropology, we sort of came late to the game, if you will. We're all way behind the 8 ball. With the work that I do, it really is looking at the space between health, equity. Oftentimes that's what anthropologists do. We work within the community, and oftentimes it's very specific to equity and now extreme heat, because extreme heat is the number one health risk from climate change for both mortality and morbidity. So there's a huge need to begin looking at extreme heat from a public health perspective. I came to heat, if you will, relatively late in the game. I was recruited by an urban forestry program as we were all coming out of COVID to specifically help them anchor their urban forestry program, which is, planting trees, increasing tree canopy to reduce heat. They were very interested in creating an initiative, and that's what they brought me on board, to sort of unify all of their programs with a health message. And it was at that time that I began looking at the literature, looking at the research, and I honestly thought, would have been about 2-3 years ago, I honestly thought there must be a dearth of data. And I found quite the opposite. There was about 30 years worth of data that showed a very empirical framework for the connection between heat and nature exposure and human health. And it was at that point in time when I realized this is not just a research issue. We need more data. It really is an issue of building awareness, education, and community engagement at all levels, including urban planners, medical community, etc. So that's sort of how, as an anthropologist, I came into that sphere. And I think what happened was last summer, which I'm sure you're aware of, was the record-breaking heat
Brutal.
That we had.
Yeah.
That became a game changer for me. So at that point, I had been working with the urban forestry program for well over a year and a half, I believe, and felt really good data, put it together, knew what we needed to do in terms of outreach and education. And then what I saw happen really catapulted me into where I am now, which is moving into a role of advocacy. What I saw last summer was, and in Texas in many ways was ground zero and remains ground zero. We saw public health transition literally from an invisible public health crisis into a full-blown humanitarian crisis. And for context, I think your audience may be familiar with this. One of the most riveting examples of that transition occurred when the LA writers went on strike. I think you may remember that last summer. And what they began doing, like you do when you strike, is they began picketing in front of the Universal studio. And almost as soon as they did that, Universal went in and literally cut down the tree canopy from where the workers were, where the strikers were
Wow.
walking, to expose them to extreme heat in the hopes that it would remove them from picketing. Eventually, Universal Studio was fined, I think something nominal, but it really resonates that message. Clearly, heat was being used as a weapon in terms of trying to negate this strike. And when I began looking at what was happening throughout the country, and again, specifically in Texas, I saw increasingly this humanitarian issue manifest. So, for example, 2/3 of Texas prisons are not air conditioned, which is, if you live in Texas, you know
Unbelievable. Yeah.
that's a big deal. So, when the ambient temperature is well into the three digits, that is a lot higher in these facilities that are, they're very little ventilation in the cells. It's cement, it's metal. And so A&M's done some studies. There have now been several studies. The inside temperature for the prisons are easily 110, 120 into the 130s plus.
Wow.
That is a public health issue. That should not be used as a deterrent or as retribution. Families are afraid to speak out. And, the other factor is that we have, if you look at the prison population, they have all of the risk factors for making heat a true mortality and morbidity issue. It's an aging population, mental health issues, and substance abuse, all of those issues. And what we know is that the heat will also contribute to violence. We see huge escalations with domestic violence during hot months. We see crime rates escalate. So again, not to have an air-conditioned facility. In Texas, the county prisons are required to keep the temperature, I think, at 85. And of course, federal is at 73. And so you've got these state prisons where literally men and women are boiling in there. It's inhumane. The other thing that I saw happen was along the border. There was a medic that came right out and said, "I have had a moral moment." And he produced last summer a memo that was instructing him and his colleagues to withhold water from the refugees that were on the border waiting to be processed. And he's on record for saying, crossed a boundary. This is a human issue, right? And not surprisingly, we also began to see at that time, there are a lot of humanitarian groups who have historically, strategically placed barrels of water for refugees and the migrants. Because, of course, if you're in the desert and you don't have water, it's a death sentence. So you find bodies. So what happened last summer were these barrels of water went mysteriously missing. Again, a human rights issue. And you see with the homeless community, they have about a 50% higher incidence for dying from heat than those of us who are housed.
Believe
Not
it.
surprisingly, just for the record, we had a 12% increase in homeless population last year alone.
Wow.
And so you've got this huge public health issue in Phoenix, which had extraordinarily even hotter than Texas temperatures. They saw last year the types of injuries from the heat, third-degree burns that were life-threatening from people falling asleep on the concrete, that it's a game changer, right? So if you look at all of these issues individually, you might think, but if you look at it holistically and you see we've got prisoners that are not air-conditioned, you've got medics being asked to withdraw water, you've got this Universal Studio strike issue. In some, I saw a big transition, and it was at that time where I decided I can't stand on the sidelines. I can do something about this because there are not a lot of advocates working in this space. I have opened up an advocacy, build awareness, by myself, solo type of organization, if you will, trying to make an impact because it's that critical.
And doesn't Texas have rules or laws that if people are waiting in line to vote, you're not allowed to take them water? I mean,
that's a new one for me. I don't know, but I will definitely look into
check that out.
That's
I remember it's either Texas or someplace in the country where, but I want to say it was like down in Houston. There's also kind of the tree canopy intersects with kind of the water conservation side. Cities are realizing that tree canopy is pretty important for many reasons, and that we do need to continue to take care of those trees. I know when Austin went through the terrible drought of 2009 to 2015, the original drought management plan, when you got deep enough into it, it banned all outdoor watering, and that became a problem. Not so much people thinking about maybe directly the link between trees and heat, but certainly that's there. It's like, do we
Absolutely.
really want to lose our tree canopy?
You bring up a good point, which is a really critical point that I also see as being really challenging, which is these are not monolithic problems. Oh, it's a heat problem. It's a water problem. It's an air quality problem. They're all, I use the term One Health. They are connected. I mean, look what's happening with water, with the treaty with Mexico right now. All these, South Texas farmers, because of the heat and their inability to get consistent water for their crops, are having to close down shop, literally. And so, again, it's not just the heat, but when you add heat and water, and when you add all of the other elements, these are the types of problems that are going to really require more than just what I see right now are the cities that are adopting climate action plans tend to do so very myopically, very narrow-minded, like, oh, we've got tree canopies. That's great, unless, a windstorm comes in and knocks them down, which we just recently had in Dallas, right? We have to be able to have a systemic, holistic approach to addressing heat and all of these other issues that are part of it, including water.
Yeah, and I don't think people realize that the importance of heat to the water cycle, and so a lot of the climate models are ambivalent either way, and whether it's going to be wetter or drier in Texas, and a lot of people are focused on that. So it's like, okay, we're going to get the same amount of rainfall, we'll have the same amount of water. The heat affects the landscape. You get a lot more evaporation, you get a lot more plant use of water.
Mm-hmm.
And that all means the soils get drier faster between rainfalls. You get less water going into our streams and rivers and less water recharging our aquifers. So it's all kind of comes
It's all
back
connected.
to that
It really
heat.
is. I see the same thing, just for context, with air quality, right? Heat makes air quality a lot worse. And when you factor in wildfires, right, which is what we saw last summer,
Mm-hmm.
that air quality and the respiratory diseases and illnesses that come from that are huge, right? So I think, to your point, it is really critical that we begin not just focusing on one element per se, but that we begin understanding the complex ways in which these events are engaging and in affecting health and landscape.
The summer last summer seemed like a watershed event for Texas as far as heat, and it was the hottest on record.
Mm-hmm.
For the state. And it's the first time I had so many friends and acquaintances, say, you know what? I've just about had enough of, being cooped up, working outside for a little bit and getting exhausted. Are you seeing any trends like that, or are there other ways? I mean, it's not as serious as warming you up to the point you kill somebody. And as you mentioned, we do see increases in crime, but just the general malaise associated with the higher temperatures.
I think yes, and I think that one thing to keep in mind is that heat affects us all, but it doesn't affect us all equally. So these are really critical equity issues. And those with the least resources are less well able to afford what it takes to adapt. So, if you're in your air conditioning car and if you're going into your air conditioned house, you're going to be able to adjust relatively well. But there are so many people that either don't have access to reliable air conditioning because of housing that's not up to code, or they can't afford the electric bills, right?
Mm-hmm.
That's really significant. And I think that we sort of had this false security of, well, technology is going to save us. We have ACs, which of course, look down the road, that's going to continue to increase the problem that we have. But for the immediate time, what I see is if you are in a position to, to be able to mitigate the heat through your own financial resources, or you don't have to go to work, or you're not working outside, then it's easier to make the decisions of mobility. But I think that if you look at our most vulnerable populations, and by the way, the vulnerable populations include small children, the elderly, pregnant women, huge. We're not even screening for pregnant women. There's some studies that came out recently that showed a woman who's exposed in her third trimester of pregnancy to 3 consecutive days of temperatures of 95 or above, which is Texas in the summer pretty much, has a 22% increase of severe maternal morbidity, including death.
Wow.
It's huge, right?
Wow.
And so I don't see any alert systems. Physicians are not routinely screening for this. So the point is that it's the vulnerable communities and populations that are most at risk for that. Long term, I think Texas needs to be thinking about that, though.
But are we effectively tracking and monitoring climate-related health issues?
The short answer is no. We're getting better. There's an awareness. It's an extraordinarily complex challenge and problem. So for context, the way that we typically look at mortality and morbidity, the way that we count it, is by using death certificates. Hospitals use something called ICD codes. So every time you go to see your physician, it's usually more insurance. It's typically something that is used for insurance, but we also use it to look at health trends. So you get a code. If you have a heart attack, you're going to get a code, and then you're going to get a code sub for that. What contributed? Was there also a respiratory issue? That doesn't work really well for heat issues. So what we have is, and this is not controversial, almost everyone will tell you, we are grossly underestimating how many people are dying from heat. The good news is that, and I use good with those air quotes, we have recently begun to get some really good data using epidemiological modeling. And what it suggests is that each year, depending on which study you look at, we're losing about, in the US, we're losing between either 6,000 to 12,000 people are dying from heat each year. And that's a lot more reliable. Officially on record last summer, we have, using the old way, I think 702 deaths, which is, we know, way, way off. Some of the most interesting work in terms of establishing an empirical surveillance for mortality, morbidity is coming out of Arizona's leading everything. Their chief heat officer in Puma County is sort of rewriting, hopefully, what will become something we can all use. But the bottom line is that we're not good. And then when you factor in how people are getting sick, right? That's just death counts, right? What we now know is that heat has a much more complex and nuanced way impact on human health than we've known. So now, for context, the other data that's coming out is that we always talk about extreme heat and its impact for health. Some new data suggests that you don't even need to have extreme heat. It's just constant exposure to even moderate temperatures may be really detrimental to human health. So that story, we're, again, way behind. It's starting to get better, but we need money, right? So what happens is, if you've got, think about this, the vast majority of healthcare providers, medical school, nursing school, are not being trained to look at climate change, including heat. And so if you're not trained to see this and to understand it and to do preceptorships where you're practicing with your mentor, you're not going to code that death the right way, right? Mm-hmm. And then if it's not coded the correct way, then it's not going to be reported in a way that's accurate. So the point of this is that even before we can get to the context of training and funding, we've got to start educating our healthcare providers. They have to be trained on how to do this. Most of them probably wouldn't know, unless you're an OB-GYN, for example, that connection between third trimester heat exposure. And I'll say one more thing. The other really interesting data that's, published in peer-reviewed publications is that mental health is significantly impacted by extreme heat. Bipolar, schizophrenia, anxiety, depression. That's huge. Is that getting coded for heat? Probably not.
All right. Well, thanks again to Dr. Jones. Just a fascinating conversation about heat and people and policy making. We don't want to say struggle with it. To me, it is what it is, and there's different ways you can be effective. But policymaking always seems to move much more slowly than the needs that are out there. But thankfully, we've got folks like Dr. Jones that are out there helping to inform people, advocating for for changes that'll protect health and human safety in this warming climate. We've got our producer Sarah Wingfield here who has fact checked me. So she's going to provide some fact checking. Is that right, Sarah?
Yes. Okay. Hi. So during that interview, Robert, you mentioned a law making it illegal to hand out water to voters at the polls. And you were right about the law, but it's just not a Texas law.
Oh, okay. Yeah.
So it was a Georgia law. It's called the Election Integrity Act of 2021, also known as the Georgia SB 202, and it prohibited anybody from giving voters food or water within 150 feet of a polling station or within 25 feet of voters standing in line if they were outside that 150 feet. So Georgia's not the only state with this type of law. North Carolina has implemented a similar law, and another similar law in New York was recently overturned. Laws like these are called line warming bans.
Mm-hmm.
And so vote buying is obviously of concern, and bribing or buying votes is unlawful in all 50 states. And line warming refers to providing that food or water to anyone in line at the polls, and kind of stands in this gray area between the vote buying and keeping people in line so they actually make it to the voting machine. So most of the time, people or organizations that are offering the food and water to voters are pretty much just trying to alleviate some of the hardships that may be posed simply by waiting in line. So ultimately, as an effort to further preserve the democratic process by making sure as many voters as possible stay in line to cast their vote. But on the other hand, there is concern that line warming could be used as a political tactic, circumventing the vote buying laws, and could be used to sway voters one way or the other, depending on the value of the food and beverages offered to those in line and by whom. But the argument against line warming bans is basically that they could effectively result in voter suppression as well. So this could be taken advantage of by certain districts by reducing the poll station numbers, as we've seen in Texas actually in recent years, and thus forcing voters into the longer lines and experiencing those hardships and getting discouraged from continuing to stay in line. So this is just kind of an interesting further yes and to that climate, human health, and policy relationship conversation that we were having with Dr. Jones.
Yeah, certainly makes sense to not have voting advocates be providing benefits to folks standing in line, and especially they may be taking care of their own voters versus, say, the other voters.
Yeah.
So, but at the same time, it does seem like there's a need to take care of voters in some way. So maybe there's a third party, non-affiliated, that allows people to be able to take their vote. Yeah, what I remember was, and maybe it was in Atlanta, but I remember something had gone wrong at the polls that had delayed voting past the voting time. People were in line in the blazing sun, and they were disallowed to be provided water and things like that. But
we do have more resources listed in our show notes for the listeners that would like to dig into this a little bit more and get the facts. And just a reminder for our listeners, this was such a great interview with Dr. Rose Jones that we decided to split this into 2 episodes. So this was just that first part, and next month we'll have the second part. So we're looking forward to that.
So do you have any good news, Carrie?
Yeah, I got some good news.
Oh, good.
I'm gonna give you a little dose of the bad news first, but then it'll make you feel even better about the good news. So there was an article that came out this month from an organization called the Surfrider Foundation. We don't hear about it as much here in Texas, but they actually do have a chapter here on the Texas coast, and they've set up what's called a Blue Water Task Force, which is monitoring beaches all across the country, including the coastal bend of Texas. And so they put out their 10 most bacteria polluted beaches in America. We are not on it. Yay!
Yay!
But the good news keeps coming. They did list Texas. We're in the beaches that are monitored, and unfortunately, bacteria rates are rising all across the country in both fresh and saltwater environments. And one of the causes is that stormwater washes chemicals and pollutants down when we get a storm. And then if we get really severe storms, a lot of communities, actually, it's surprising, but a lot of communities have kind of open sewage that just flows right into the waterways. And I think a lot of us believe that doesn't happen anymore, but it's actually really common, quite common. So you have a lot of sewage washing into the beach areas, and they don't have us in the top 10. And I was surprised, actually, Hawaii shows up several times. And you always think of that as being a really pristine place.
Right.
And California as well. But they did link to an article within this article that in 2022, fecal matter actually posed risk at 90% of Texas beaches. So we are not exempt. And I thought it would be good to share that for folks. But 90%, that's 55 beaches out of our 61 beaches, had unsafe levels of fecal bacteria at least once during 2022. 8 beaches on Texas coast actually were over that threshold 25% of the days. So you drive down to the coast 1 out of 4 days, it may be harmful for you to swim. And scientists estimate 57 million cases of people getting sick every year from swimming.
Wow.
In lakes and rivers and on the beach. So one thing you can do is go to texasbeachwatch.com. And they will tell you, like most live information, it's not live to the minute. The sampling is done weekly, but you can see the conditions before you make the drive to the coast. You might want to do that. But all of that was really a tee up. We did mention it on our last episode. Since we talked to you, we had a press conference officially announcing a $500,000 gift to the Meadows Center to conduct research and fight this kind of fecal contamination on the Texas coast. And I thought maybe, Robert, you want to share a little bit about the press event?
Sure. So this grant's going to be used to work with citizen scientists through Texas Stream Team and to collect more data on what's going on the coast. And then also to pull the existing data and the data that's being collected, such as temperature, maybe what's going on with the tides, other factors, and then using an AI tool, an artificial intelligence tool, to then relate that or find relationships to unsafe swimming conditions. Basically provide a real-time assessment of, is it safe to get in the water or not? Right now, like as you mentioned, there's like a 1 week delay, but if those measurements of fecal coliform can be tied to other environmental factors that are being measured in real time, then we can provide
make a best
actionable.
Guess. Yeah. And I think another thing, our Texas Stream Team program has been trying to innovate and has been innovating ways to measure that and measure it more quickly and cheaply so that citizen scientists can actually be a part of the solution in the monitoring of these kinds of contaminants. So.
Yeah. And the warmer temperatures are part of it. But then also rising sea levels and septic systems that are on those strand islands, increases fecal coliform. My good news article is series of articles. It's in this week's edition of The Economist that's focused on solar power. And I'll just share some factoids from the article, but it's basically the gist is that solar energy is probably going to save us, and it'll swamp out all other sources of power, including wind. And so they document the exponential growth. So they said in 2004 it took a whole year to generate a gigawatt solar power capacity. 2010 it took a month. 2016 it took a week.
Wow.
In 2023 there were single days which a gigawatt was installed, and then in 2024 they're expecting 2 gigawatts a day of installation, and they're expecting that to continue to increase at an exponential rate. They mentioned that Spain, Portugal, Germany, France, California, and Texas have all experienced negative wholesale power prices in recent months due to all the solar, where it is the primary source of energy. They also noted that, so there needs to be improvements in storage. So that can be used, that solar energy can be captured and used at night when the sun's not out.
Mm-hmm.
And they noted that there's a similar pattern in battery storage. So a kilowatt hour of battery storage has fallen by 99%. The cost has fallen by 99% over the past 30 years.
Wow.
They noted that the battery operators in Texas last year made over $500 million in storing energy off the Texas grid. That's expected to go up. And then finally, there was interesting idea, a company called SunTrain that is kind of dealing with the grid issues. Like the solar is growing so fast that the grid doesn't have the carrying capacity. And so SunTrain basically puts batteries on railroads.
Oh, wow.
And so the SunTrain rolls in the town where the solar cells are, charges up the batteries, and then they train that to where it's needed and connect into the grid.
Whoa.
And they can do that very cost effectively. And they can deliver 3 gigawatt per 100 car train, which is similar in size to a coal train, which I thought was pretty clever.
It's incredible.
So yeah, a lot of good news. They have some graphs. Unfortunately, the articles are behind a paywall, but they have some graphs just showing kind of what the future power mix looks like. And it's like, gosh, by 2040, it's dominated by solar, if current patterns continue the way they are.
Cool.
It's pretty cool.
Aren't we raised with sunshine ourselves?
Yes.
Well, thank y'all for joining us.
Yes.
We hope you find a way to stay cool and come see us in July.
And stay safe. This heat stuff is a real serious deal. So
yeah, take care of yourselves.
Yeah, take care of yourselves in this heat and your loved ones, and watch the folks in your neighborhood.
That's right. See you soon.
All right. Bye-bye.
Thank you all for being with us for another climate conversation. We hope you can take this information with you into your everyday life to help spread the knowledge and understanding of climate topics and their effects.
This podcast would certainly not be what it is without listeners like you. If you're listening through Spotify, take a quick moment to help us out and engage with the quiz and poll we've attached to this episode. And be sure to check the show notes for helpful links and resources.
Thank you to our funders for the Fahrenheit 140 podcast, both the Meadows Foundation and the National Oceanic and Atmospheric Administration. We'd also like to thank our communications team, Anna Huff and Sarah Wingfield.
If you'd like to learn more about the Meadows Center for Water and the Environment and how to visit our vital spring lake for a ride in a glass-bottom boat here in San Marcos, Texas, be sure to visit our website, meadowcenter.txst.edu. We have a number of climate resources there, including free lesson plans for your K-12 curricula. Sign up for our newsletters to get news, updates, and event opportunities hot off the press. I'm Robert Mace.
And I'm Carrie Thompson. Thanks for being part of the conversation.